Welcome back to another 3 questions in 3 minutes with our 2022 Power Players in Healthcare. Today, I am pleased to be joined by Karen Ignani. Karen is the CEO of EmblemHealth family of companies. Karen has, during her time at EmblemHealth, spearheaded initiatives aimed at modernization. And she's helped EmblemHealth to build a network of both primary and specialty physician practices. Today, we're going to be discussing the intersection of healthcare and technology, as well as the rise of holistic wellness practices and the language of wellness and mental health and self-care. So, Karen, welcome.
Thank you, Anna. So nice to see you. Thank you so much.
So I know that EmblemHealth is kind of at the forefront of modernization, and one of those initiatives that's relatively new is this launch of an online portal for healthcare providers and teams of physicians. So I wonder if you could talk a little bit more about it. I know that you've been a big advocate for the modernization of healthcare, and how does this online portal contribute to those efforts? And looking ahead, can we expect technology to play a bigger role in coordinating patient care?
Thank you so much for this question because it really it focuses and shines a spotlight on what modernization means. And essentially, it means taking clunkiness out of the system. So think of physicians' offices or hospital teams calling, faxing, what have you. So what this means is we can do away with those modes of communication and replace them with real-time communication. So it's ease and convenience. So a physician's office can easily search claims in real time. They can send us files. They don't have to pick up the phone now, which is really exciting. They can check payments. They can check their status of what do we know about their patients, what gaps in care may be present, what should physicians know about their patients that we know through the data. And really, it creates a stronger partnership opportunities.
Yeah, I think we've all had that experience of going into the doctor's office and
Yeah,
having to repeat the same things over and
exactly.
over. So hopefully this kind of cuts
Mhm.
down on some of that
Mhm.
time too and just makes everything much
Yeah,
more integrated.
that's our hope as well.
Awesome. What a great goal to have. And I know another aspect that you guys have been focusing on too is wellness and really looking at health in a more holistic way, which I think is something that we've seen kind of across the nation, that healthcare has really taken on more of a preventative, self-care, wellness. This language is kind of being used more and more, and Emblem Health seems to also be embracing some of those changes and that shifting perspective. So, you guys have actually recently established a company called WellSpark to kind of bridge this gap between physical and mental wellness. So I'm hoping you could talk a little bit more about it.
Yes, we created this company a couple of years ago. We have almost 1 million people being served by WellSpark in 30 states. Through the experience of the pandemic, particularly, we became very convinced that we see stress, we see depression, we see isolation for people who live in large cities, which you wouldn't expect, but you see. And we can't ping them to get a mammogram if they have stress, if they have depression, or they're suffering from a variety of mental health conditions. So that's what WellSpark does. It provides one of the most exciting programs is burnout for individuals, for groups, for employees. We're treating hospital workers now, teachers across the country who are suffering from burnout. And they're not really sure exactly what it is, but they know something's going on. So we have coaching, we have guided support, and follow up. If you build a foundation on those interventions, then you can help with diabetes, you can help with asthma, you can actually work with people to make sure they're getting the preventive care they need, but you clear their mind to be able to focus on the other part of healthcare. So healthcare is multidimensional, and we're focused on bringing all of the skills and supports together to deal with the whole person.
As we've been talking about too, anxiety and depression and these issues that everybody struggles with manifest so differently in different people. So for you personally, what do you like to do that helps center you or ground you when you're feeling a little bit off?
I love to run, and that's probably my go-to strategy. But I also love walking my dog. and this is going to sound really weird, but talking to my dog along the way. He doesn't speak back, but it just is an outlet for me sometimes to work on a problem. And, dogs, cats, people, they love to interact with others. And it's a great, I think he enjoys it. Um, he's never particularly negative about what I have to say. So that's a blessing. But yes, definitely walking with the dog, running. I do Pilates with my yoga mat, and I do other things, and I try to eat right. I think that's important too, particularly when you feel stress, not to load up on carbs. So there's a temptation to do that for everyone. It's my Italian heritage, so I think pasta. But it's very important to try to fight that urge and think in your most stressful times, try to really go the other way and compensate and go for the salad rather than the pasta.
Definitely. Yeah, I have a little sticker on my fridge that says, "Eat your fruits and vegetables," just to give
Exactly.
myself a little reminder every
Yeah.
day.
Yeah.
And I think too with the dog, they might not be able to talk back, but there are therapy animals. I mean, there's definitely
Exactly.
something to animals and having that
There is
kind of
something to this.
interaction.
Yes,
Definitely.
exactly.
So, Karen, thank you so much. It's been wonderful. I feel like I've learned a lot about Emblem Health and the new projects that you guys have coming up. So, thank you so much, and thank you for being a power player.
Thank you, Anna. It's an honor. We very much appreciate it. Thank you.
Thank you.